Hey guys, as we promised. So Amani is sitting, it's 9:13. Actually, she's sitting for her interview at 10. So we're gonna make this quick. We're gonna practice her interview and you guys are gonna see it. All right, Amani, tell me a little bit about yourself.
My name, you know my name. Sorry. I am 33 years old. I'm a wife and mom of 3 kids. I graduated from Amani'S.
This is what happens, guys. This what happens, guys. You know, if you got a family, interruptions happen every single day. هاتي أنا هحاول hold it. Hey, Angelina, say hi to everyone. Hi.
Shut up.
All right. Yeah, tell me a little bit about yourself.
I am a wife and mom of 3 kids. I am 33 years old. I graduated from nursing school back in 2007 with a bachelor degree. I started my career job as a registered nurse working in intensive care unit back home for a couple of years. Then I moved to Saudi Arabia. I worked at one of the biggest hospital in the Middle East, which is Magnet Hospital. I worked first as a registered nurse in unit intensive care unit for 3 years. Then I transferred, like it's local transfer for pediatric oncology due to the proximity of the house. And I worked there another 3 years, and it was the best experience ever. And after that, we moved back to Lebanon, and I worked for another 1.5 years back to a unit intensive care unit. And finally, we immigrated to the States, and I was pregnant. I had my 3rd child 6 months ago here at CAR. And it was the best experience. And I passed my NCLEX this January. And this is the first position I am applying to, and I hope it will be the last.
So why did you move from Saudi Arabia back to Lebanon?
Because we were planning to immigrate to the States. So that's why we moved. Then we process our papers to come.
Okay. So what is the capacity of one of the hospitals that you worked at, and the capacity of the unit as well, and then the nurse-patient ratio?
I believe the hospital in Saudi Arabia was around 1,200, but I think now it's more because they were building new centers. And the unit capacity for the pediatric oncology outpatient, it was divided into different areas, like treatment area, 28 beds, hematology plus BMT, it's like 8 beds with the hematology clinic, and upstairs there's 3 more clinics: solid clinic, solid tumor clinic, neuro clinic, oncology, and leukemia and lymphoma. And what the ratio was a 3 to 4 according to the acuity. Okay.
مش رح يفهم عليك.
Okay.
وبدك تقولي وبالكلينيك.
But when I'm in the clinic, of course, I will be assigned for that specific doctor, so I'm responsible for all the scheduled patients.
إذا بدك تقولي بدنا تقولي treatment area or infusion area حتى يفهم. Tell me a little bit about a typical day on your unit.
First thing I do, if my assignment is at the clinic, I try to arrive early in the morning. I prepare all the charts, make sure all are as listed in the list. I do my extra assignment, which is safety checks.
Explain in the charts and
which is safety checks, and I make sure all the equipment, medical supplies are prepared for the LPs, for the procedure rooms. For the paper charts, I check the previous cycle and prepare a physical assessment of vital signs downstairs in the physical assessment room for the patient, and then they send the patient to the lab. The patient do the lab, they wait their turn to come in. So by the time they do the labs, I will review their, after they do the labs, I will review their results. If there is any issue or concern, I will address it to the doctor. We might hold the chemo or proceed to the chemo according to the whole picture after they will be seen in the clinic by the physician. So if there's no issues and the patient will be proceeding the chemo, we will fax the chemo order to the pharmacy, and the patient with a paper chart will be sent to the infusion area and he will take the chemo downstairs. For some cycles, there is LP with a cycle, so we'll do the LP in the clinic, in the procedure room, and then after that, we'll send the patient downstairs. And so on with each patient until the end of the day.
Okay, this is the best time you explain it thoroughly مع إنه story. What are some of the cases that you take care of on your unit?
I remember ALL, AML, rhabdomyosarcoma, Wilms tumor, retinoblastoma, Ewing sarcoma, brain and CNS tumor.
What are some of the narcotics or painkillers that you use?
We used to use morphine for outpatient, is what I remember. We used to have morphine as
a... For peace oncology, we only use morphine. Have you done electronic charting in the past?
Yes, we used to have Cerner, and I was a super user for like 3 years, and I participated in a project for upgrading the system from ISIS phase 2 to ISIS phase 3.
Yeah. So I was building.
We were doing a system and review, system validation, and training material, stuff like that.
I بحبوا كلمة building. And you were building the system on the back end.
ما design ولا build.
هون يمكن بيستعملوا build أكتر. دايما هيديك الIT بتجي عم تضلك تقول building. How fast can you type?
I can type around 35 words per minute.
How would you deal with a conflict with a colleague?
I have 2 rules to follow with the conflicts. I be professional and assertive. And there was one time I remember I was a member in the hand hygiene committee, and one of the senior nurses went out of the isolation room of one of the patients did not wash her hands. So I just remind her, don't forget to take the glove before going out of the room and wash your hands. She just ignored me and she didn't accept it. So what I did, I waited an hour or so and I approached her again, asking if we can talk privately. So we went to the medication room. I told her, don't take anything offensive. It's not personal. I'm just reinforcing the WHO standards and the risk of hospital-acquired infections. So we have mutual goal and we are both patient advocates. So it's for the patient safety. She said, yes, you're right. And I was just in a hurry. And I will try to make it next time.
Oh, good. Great. So, have you ever had a medication error and how did you deal with it?
Honestly, I have never in my whole career journey. And I hope it will never happen. But in case if it happens, I deal with it in a professional way. I acknowledge it. I do an incident report. I reflect on it. I see the weaknesses and the reasons behind that mistake, and I will learn from this experience to improve myself for the next time, not to let this mistake happen again.
Okay. How would you deal with an anaphylactic shock or anaphylactic reaction?
First thing we do for anaphylactic reaction or any other reaction, we stop what's going on, infusion of blood, we change the set, we give, if we have PRN orders, we give the orders, if no, we call the physician.
PRN reaction.
PRN reaction meds. If not, we call the physician. We assess the patient, take the vital signs, check his breathing. If he needs oxygen, we supply him with oxygen, and wait the doctor for coming orders. Some they will, after the patient will settle, they will proceed with the minimal rate. Some they will change the order. So
Minimal, lower rate.
lower rate.
Do you have ACLS and BLS?
I used to have BLS, PULSE, and RP, but since we traveled to the States, they are all have expired.
Half expired?
Have.
Talk a little bit about a performance improvement project that you have participated in.
Yeah, project. نسيت شو حكينا نحن. We used to have heparin for flushing all central lines and portacats in pediatric oncology, but we realized that some patients, they were having fluctuating INR results. So we had a task of 4 nurses to update this practice. So what we did, we did our research. We checked out the latest evidence-based practice and submitted to the.
So we found evidence.
Yeah, so we found evidence that supports flushing it with only normal saline. So we submitted that evidence to the professional organization, professional development committee. اللي شيء تاني اتذكره عمالي انساها.
هي اسمها
Professional Development Committee. So what they did, they reviewed this practice, and after a certain time, making sure that this is genuine and everything, they implemented in the data oncology. And we started using normal saline corticosteroids.
How do you seek professional development?
Well, there is many ways I seek professional development. First, I try to be certified in the area that I'm working in. I seek professional development first by attending more workshops and conferences related to the specialty that I'm working in. Also, being certified in the specialty that I'm working in. And شو قلت امبارح؟
لا خلي السيرتيفايد هي آخر شيء.
شو قلت امبارح؟
Professional organization.
Being a member. Last but not least, I try to be certified in the specialty that I'm working in.
Okay. What are your short-term goals and long-term goals?
My short-term goal is simply to get this position, and my long-term goals are if I'm in that position, so I will plan to be certified within the first 2 years, and down the road within 5 years, planning to consider enrollment in PN program. PN program.
NP program.
Nurse practitioner program.
Okay. What are some of the quality indicators you used on the unit?
I remember we used falls, claps. We used to have CLAPSI, falls, and IV infiltration.
Tell me a little bit. So you said that patients call the outpatient and, if they're having any symptoms or anything. So how did you deal with those calls? Like, walk me through a call.
Usually the mother is the one who's calling us. So if she will explain the problem of the patient. So if she will say his اللي ضارب بتروح على الطوارئ ما بدقوا.
I know. بس نحن بدنا
بدقوا for medication for معلومات.
Okay, فيك تقولي إنه medication refills. فيك تقولي sometimes they are asking about side effects, kind of patient education. Okay. هذا بتفهمنس.
نعمة كانت تعمل هيك بدقوا لك كثير.
Okay. بدنا نقول إذا دقوا لك فيفر شو بتقولي ولا febrile neutropenia you send them to the ER.
Most of the cases they call like for fever, signs of flu. So if they are we had that standards that if fever above 37 point, this kind of
37.8.
yeah, if it's above 37.8, we ask them to go to the emergency room, and sometimes they will ask about some medication refill. Sometimes they ask about some specific side effect of medication, so we educate them about it, what to do, or sometimes they ask to clarify the doses, or if they miss a dose, what they do, or something like that.
So kind of patient education.
Yeah, so mostly like patient education. Yeah.
قولي كمان, I would like you to say, you know, in the hematology clinic, we have a lot of sickle cell patients. Sometimes they call that they are in pain. If it's, we send them to the emergency department. Sometimes we bring them in, but if it is at closing hours, we send them to the ED.
Yeah, and we used to have in hematology clinics. We used to have sickle cell patients, and sometimes they call having crisis. So if
pain crisis.
Pain crisis. So if it's within the working hours, we ask them to come for painkiller and infusions. If not, we send them to the ED.
Okay.
Medication.
What are some of the chemotherapy medications that you've used in the past?
Sure.
Cytoxan, methotrexate, vancomycin. Have you do you have experience with oral chemo? Do you have experience with oral chemo?
We used to give oral chemo and شو بيسموه تاني؟ شو التاني؟ oral شو التاني؟
IV.
هيك بيسموه IV. هو central line.
IV chemo اسمه IV chemo. IV يعني IV.
We used, yeah, but for me, because most of the time
هلا أنا بدي إياك تقولي لا oral chemo ما عندك experience. لأنه oral chemo هون it's way different. يعني هونيك تعطي حبة VP16. عرفتي؟ oral chemo هون عالم كبير. But just say no. No, we used to give IV chemotherapy.
بس كانوا الكيدز ياخذوا كيمو oral.
مثل شو؟ هيدا 6 MP قصدك اللي بالليل ياخذوه؟
لا حبوب كان يكون هيدا، وانا كثير ما اقدر وبتذكر نعطيهم اياهم على البيت.
بس هلا عندك knowledge انت بالاورال كيمو side effects.
They used to give, okay. But I don't have that experience. No, I don't have that experience.
Okay.
Okay.
All right, guys, there you have it. I hope you liked it, and drop a comment down below. All right, we've got to go. It's almost 9:32. Our interview is at 10. Let's go. Cheer up for Amani.